Gauteng Premier David Makhura says there's a decline in the number of active COVID-19 cases in the province. Gauteng has 24 new cases, while 15 people have died and 1,015 patients have recovered. Makhura says people with underlying medical conditions like high blood pressure, heart problems and chronic respiratory illnesses develop complications if they contract COVID-19. He was outlining Gauteng's plans to deal with the virus.
The new cases, those that were announced yesterday by the Minister, Gauteng had 24 cases. That's new positive cases. The total number of those who have passed on so far, 15. The recoveries is 1,036. What is of keen interest to me, essentially, it's those areas that show red there. So, fighting COVID requires a lot of science, not common sense. So, this dashboard also tells you, firstly, what are the areas of social vulnerability, and we map this using the Gauteng City Region Observatory and a team of researchers that always map the various areas of our province, areas of vulnerability, including what's the depth of poverty in those areas, the depth of food insecurity, the level of access to services, what kind of services are in those areas, including access to health facilities in those areas, access to economic opportunities in those areas, the infrastructure in those various areas. So we do this mapping as a matter of course. So we map the different regions of our province, and when we bring the positive cases and bring in the density of contacts in those areas, we know at the back of COVID-19, we've got other problems, and it also includes the burden of disease, the burden of some of the diseases like HIV and AIDS, TB, and other comorbidities that is now proving that they have an impact. Most of the people who pass away so far, as announced by the Minister, have comorbidities. So I want you to understand that what we are building as the COVID-19 dashboard, at the back of that is a lot of data about the nature of our province. It also has social distancing issues. You will see one of the important areas is that it is difficult to achieve social distancing in high-density settlements, which means there you've got to be much more creative than you are. And then it also tells you where social distancing is possible. And in those areas where social distancing is very difficult, once you have infections in those areas, once you have a positive case and once you have contacts in those areas, that's where quarantine facilities come into play and isolation facilities. So there's a relationship between social vulnerability and the ability to undertake social distancing. So this dashboard will be unveiled live. It is something we have been working on. We use it on a day-to-day basis in the war room. It will be unveiled live as soon as MEC Masuku and the team in the war room have finalized